5 million Americans got their wisdom teeth pulled last year. $3 billion to the dental industry. It is such like a business. Like, they do not care. They do not give a single fuck. Sleep apnea is one of the most undiagnosed things that somebody can have. You know, I think it's like 90% of people with sleep apnea don't even know they have it. Doctors were prescribing cigarettes. You know, like, that to me is wild. And they perform lobotomies. You had an infection in your hand, they just immediately cut it off. Like, this to me, like, we are in a barbaric moment for orthodontics. Oh, you want to deal with your airway? Go see an ENT. You know, but it's like, why? Like, you should know that. If you're doing something that affects my airway, affects my facial profile, you should be educated enough to know what the fuck you're going to do. Or at least
All right, Bailey. So, what's going on, Bailey? How can I help you? What do you want to talk about today?
A lot, to be honest. Mostly retraction, extraction, facial profile, airway, everything you really talk about. But basically share my journey and the importance of understanding what is fact and what isn't. Because there's a lot of misconception out there.
Facts. That's facts. There is a lot of misconception. There's a lot of wrong information out there. So, I mean, you're a handsome guy. Have you had extractions? Like, what's going on with you?
Just my wisdom teeth. That's it. But
that makes sense.
I didn't believe it was going to have any sort of effect on me, especially because when you look up on the internet pros and cons of getting your wisdom teeth taken out, it's not really going to mention anything about your facial profile or your airway. So,
True. All right, so let's dive right into it. So, what do you really want to get? What do you want to start with? Fire away. First of all, let me step back. How old are you?
20.
Where are you at right now? You're 20.
I'm in Miami, Florida.
Sick. Yeah, Miami's
just moved
tight.
Down here about 2 years ago. It's fast, man. Say that.
Yeah, for sure. Are you with your family?
Yeah, I'm with my mom and my sister.
Nice, bro. And are you from down south? You seem to have a southern accent.
Yeah, I'm from North Carolina, Raleigh.
Oh, shit.
So it's cool.
I love the South, bro. Respect to you and respect
Bojangles,
to the
man.
South.
Bojangles. That's where it's at.
And I'm thinking of that Wagon Wheel song that popped off a couple years ago. Remember that song?
Oh, yeah.
Rock me, mama, like a... That song. Isn't that a North Carolina song?
Probably, man. From the Carolinas somewhere.
So, well, good, man. So, all right, fire away. Take it away. You lead the way.
Well, so in 2019, I had my wisdom teeth taken out. And actually, late 2018, I had my wisdom teeth taken out. And early 2019, I was gifted the opportunity to have braces, which starting out, I really didn't have that crooked of teeth. I really didn't think I needed it, but the opportunity was there, and why would I say no to that? So I did it, and in the consultation, the gentleman I spoke to, I was asking him, how long is this going to take? And I was under the perception of it was only going to take about 6 months. I chose Invisalign. It was relatively something he had experience doing, so I was like, yeah, let's do it. And signed the papers. I was 17 at the time. Started it off. Came back about 6 months later. My teeth were straight. Everything was fine. And he goes, well, I actually didn't see him again. It was another doctor. And they go, oh, you got to start wearing rubber bands. I was like, rubber bands? Like, oh, all right. I don't really think I need them, but they're like, yeah, you have to wear them. So I went home and I was talking to my dad. I was like, Dad, like, I don't want to wear these shits. Like, I don't want to wear fucking rubber bands. Oh, you have to. I'm paying for them. So I was like, all right, fine. So I did. And about after a couple weeks, maybe a month, I started noticing my bite was like changing. And I did not like it. I did not like it at all. It was very odd. It felt uncomfortable. And of course, everyone's going to say, oh, well, it's fine. You have to trust the process. My sister had braces with the exact same place. So she was like, bro, you're fine. You just have to wear them. I was like, all right.
Trust the doctor.
Exactly. And so
he's got a white coat. He knows.
Right. And so I go back to my follow-up, and I think it was about 2 or 3 months after I was wearing the elastics, and I tell the doctor, I was like, hey, I think my body's good. Like, I really don't want to wear these rubber bands anymore. My teeth are straight. I got no reason to wear the rubber bands anymore. And she looks at the computer, different doctor every single time. She looks at the computer and she was like, well, it says here you have to wear the rubber bands, so you got to keep wearing the rubber bands. And I was like, there's no way. Like, I don't want to wear them. It's making my face uncomfortable. It hurts. Like, I don't want to wear it. My body's fine.
Yeah. I don't want to fix what's not broken.
Exactly. She was like, no, you have to keep wearing it. So I went home and I told my dad, I was like, Dad, like, I don't want to do this anymore. Like, I'm done. And he was like, okay. He was like, I'll go with you to your next visit. Just continue wearing the rubber bands until the next one, and then I'll ask if you can take them off. I was like, perfect. So he comes with me the next time, and it was a different doctor. Yet again. So I talked to him. My dad's talking to him, and we go, hey, like, this is uncomfortable. It's getting to the point where he doesn't want them in anymore. Could you please, like, put in whatever it is you need to put in for the elastics to be taken off? And he was like, yeah, I got you guys. We'll switch to a nighttime only elastics, and you'll just wear them at the nighttime. And I was like, all right, fine, whatever, cool. And this was, at this point, it must have been about 8 months, almost a year in. My teeth were completely straight at this point. I really only had crowding on the bottom. My top teeth were fine. And I had
Not
a class
to interrupt,
2.
but yeah, where were the elastics connected? Can you?
My canines, right here.
So from the canines to where? To back to those buttons?
Yeah. So I have pictures of my bite, because I know you do the open your mouth and the profile and stuff. If I could share my screen, I could show you, like, the pictures from the beginning of treatment to the end.
Yeah, you can.
You
can try to share your screen. Yep.
Okay.
Yep. Share your screen. I hope it works. Sometimes it does. Sometimes it doesn't. But go ahead, and because I want to see them anyway.
Okay. Can you see?
I can see.
Okay.
Yep.
Cool. So here's my bite. But basically, this is the change of my profile from February to when I started to when I went back. This is around the time where I was like, look, I'm done with the elastics. Like, my bite is fine. My teeth are fine. There is no reason for me to do this. And then I went back around February. They didn't want to take any pictures of 2020. And then COVID happened. So I really couldn't see them at all. And then
bro, you're
continued.
a Chad, bro.
Man, come on now. Look at you.
I'm speaking facts.
Nah, come on.
First of all, look at that hair. You have amazing hair, bro.
I appreciate that.
Look at the wait, time out. Let's just pause and admire the
not.
changes in the hair over five different sets of photos, 5 amazing hairdos.
Gotta change it up.
Holy
man.
shit, bro! You
Yeah,
should
keep
start a
on our
YouTube
toes.
channel. You should start a YouTube channel for men's hair. Dead ass. No, I'm gonna bring you on and fucking interview you and ask you for men's hair advice.
Oh, come on, man.
But continue.
So anyways, 1 second. So yeah, I was basically around this point right here. I was I was done with the elastics. There was no point for me to continue to wear them. And then around this time, I discovered mewing. Like, over COVID, I discovered, Mike Mew, Orthodontics, just like surface level. And so I started.
JawCast.
Exactly. Oh yeah. Of course, the Giga Chad himself. Yep. So I don't know. You can tell differences in my chin, like right around here. My profile started going back because my maxilla was recessing.
He was pulling it back, bro.
Exactly.
Yeah.
So, and here's an updated profile of my profile, basically. And if you look close enough, and you want to pause it, look at it, you can tell in here there's a significant difference. It's like almost pulled back here. My top teeth are pulled back. And I remember the last conversation you had with I'm sorry, I forget his name, but the last chat you had. Let me stop
Daniel?
sharing this. Yes, Daniel. One second.
Mm-hmm.
Okay.
Mm-hmm. Mm-hmm.
He mentioned he had a crossbite and he got his wisdom teeth taken out, and I thought that was interesting because he was a pianist and he played piano. I thought that was interesting. That he was having problems with sinuses and everything. That's all related. But one thing with sleep apnea is that it directly affects your temporal lobes, which controls music or your ability to detect pitch, speech, movement, and that all affects somebody who would play piano. So like he would be noticing it, significantly. And I myself am an artist as well, so I make music.
What kind? You make music?
I sing, I rap, I make beats, everything, man.
Sick.
So I started noticing a change in my perception of music, movies, life, and it was very depressing because of somebody who is like aware of or is in touch and sensitive to everything, just life. Not to sound all cliche here, but it was rapidly changing, and I couldn't really understand why. And
tell me how it was changing. What was the essence of the change?
The essence of the change was I started becoming, I don't really know how to word this. I started struggling with mental health around the end of 2019. It was like my first time really struggling with anything like that. And towards the beginning of 2020, 2021, I started feeling out of touch, and I felt like, hold on, I'm gonna need a second to like really like word this the right way.
Nah, you good. Take your time.
It was difficult to feel similarly to how I felt before, if that makes any sense.
How did you feel before? Like you had a pop in your step? Like
yeah, I mean,
was it like a change from positivity to negativity?
I guess you could say that it was more like everything, just my perception of life, my perception of my interactions with people, conversations I was having with people, music I would listen to. It started to fade. It started to dim. The feeling I was getting, and it just was really weird. I just chalked it up as I was getting older, whatever. But towards the beginning of this year, I started really noticing profile changes, and I started really feeling fatigued. Started having headaches, and I didn't really understand like what was going on, and that's when I dove into the rabbit hole of everything about this, and especially the facial profile, and then the airway. When I found out it was the airway, it was just like it was baffling to me. I couldn't believe it. Yeah. But anyways,
do you think that this was triggered by your orthodontics? This shift in your mental health? Is that what you're suggesting?
Yeah. And it sounds crazy, especially when I mention it to like any orthodontist or family. Kind of look at me like, what the hell are you talking about? But I did play football from the age of 6, contact sports. I've always been in sports my entire life.
I bet.
So that may have had a role in my mental health. But I do believe the lack of oxygen, whether it's small, over a period of time, has a significant impact on your brain.
And it's not just the lack of oxygen. If your bite gets screwed up, if you start biting recessed and your lower jaw is trapped back, every time you bite, and how many times do you bite a day? Thousands probably.
Yeah.
Every time you bite, it's like you're bad vibing yourself. It's like you're 1,000 times a day. And that can fuck with your mental health for sure. So it's the oxygen, it's the bad bite. I mean, that's why everyone says occlusion is king. If your bite is shit, bro, that wreaks havoc on your whole being.
100%, and that has significantly impacted me. These past, I would say, 6 months has been debilitating to me and my ability to really stay active.
Flourish.
Yeah, exactly. It is, and especially with something like this, where if you talk to a doctor about it, 9 times out of 10 they're gonna say you're crazy. Your bite's fine. There's nothing wrong with it. The way the teeth sit. Look at me right here. Oh yeah, JawCast master. So the way
shit, man. I hope you bought that through my affiliate link so I could get 5 cents in my Amazon affiliate link.
I did not. I apologize, man.
It's all right, bro. Get me next time.
I got you. So the way the teeth connect has a big influence on the rest of the skull, not just the maxilla. When you anchor, or what they did to me was they overcorrected my bite and they didn't see a problem with it. When you anchor to these canines up here, to these back teeth, it's pulling this back, which has an effect on your cheekbones, this top bone right here, everything. And your jaw goes forward and back. It's not at a fixed, spot. I mean, it is, but the one interview you did with the doctor who did Dame, he really
Dr. Yusefian.
Yes, he really explained it well, and he kind of connected the dots more about the influence of your bite and the rest of your face. Like, I think it is insane that you can't look up on Google right now, like, the side effects of braces or the side effects of retract, and the only thing they're gonna say is pain. It costs a lot of money. Like, they're not gonna say, oh yeah, this could give you sleep apnea or cause profile changes. Like,
you think it's insane because you just haven't seen enough yet, even though you're incredibly wise. You are incredibly wise, man. But as you'll go through your 20s, you'll get more and more black-pilled, and you'll see, to get truth in this world, you really have to dig. You're not going to find it on the first 2 pages of Google.
Right, exactly. Which is criminal in my opinion. Because if you go to a literal doctor who's doing, basically changing your entire profile, and they say, it has no correlation to your airway at all. It's insane. It makes you feel crazy when you try to explain this to your friends, family members, anybody, and they're all looking at you like, what the hell are you talking about?
Yeah, and that adds to the negative mental health effects, because you feel like you're crazy. You're like, oh wait, am I the one who's crazy? Is this all in my head? And it literally is all in your head, but it's just in your physical head, not in your psychological head.
Yeah, it's baffling, man. And
but you're in good company here, bro.
Oh, I mean, JawCast is a family, man. We all love and support each other. That's what this is about, man, for real.
100,000%.
But yeah, I was overcorrected significantly. I think because of COVID and because of ignorance from my doctor, and the head doctor for the practice I was at. The only 2 times I ever saw him was the day I signed the contract and the day I talked to him about everything that was going on, which I want to get into because that was crazy to me.
Well, you didn't see him because that dude's in the back room just counting his money.
Oh, he don't care, man. He gives everybody a universal bite and has his subordinate people go in and say, yep, looks good. According to the computer, it looks fine. The Invisalign chart, get out of here. That's all it is, man. They don't care. They do not care. And that is so wrong. It is extremely wrong, especially when you're dealing with something like your airway. Like, this affects more than just your facial appearance. This affects the way you sleep, the way you work out. One thing Daniel was talking about was he feels like he has a crossbite. I've had a chin strap. I've had a helmet my entire life. When you bite down, you know how it feels to bite. So when I'm working out, when I'm benching or squatting, you kind of grit your teeth or whatever. What I found was if I keep my mouth open slightly, because it feels more comfortable, and I kind of contract the muscles in my face, my bottom jaw goes forward and to the right just a bit. So I have like a weird crossbite, which is very odd. And in the photos, if you look, you start to see changes in my eyes and my nose. It seems like what they did was they tilted it to the left and then they brought it back, which I don't know why they did, but that's what I feel like happened to me. So
Question for you. When you say they overcorrected, what was your bite originally like? Did you have like an overjet to begin with? Were your upper teeth like in super far in front of your lower teeth, and that's why they started pulling them back?
They were not significantly further in front of my teeth. I just had a deep bite.
Mm-hmm. You had a deep bite. Okay.
Yeah. So, I do have a lot of pictures of my maxilla, like my top teeth, my palate in comparison to now, and how much smaller it is. It's ridiculous. Shit. I also think the retraction after I took my wisdom teeth out is what caused a difference in my airway. But when I got my wisdom teeth taken out, the doctors they really didn't inform me about the importance of the injection you put in the I'm sorry.
The Novocaine?
No. When you take the teeth out, you're supposed to fill it with, I think it's bone graft maybe. I'm not really sure what it is.
Oh yeah. They a little bone grafting material.
Correct. Yep. So I feel like since I was trying to do it, it was very painful, but I didn't really need my wisdom teeth taken out. When I visited my dentist and I was like, hey, my wisdom teeth are starting to hurt, his first response was, when are we taking them out? Not, let's look and
automatic.
See. Yeah, let's
it's
look
automatic
and see.
for orthodontists to
Exactly.
want to pull wisdom teeth. For whatever reason, they hate wisdom teeth.
So
I
weird.
think I've been trying to understand this. The best I can come up with why every orthodontist, even the MSC providing airway focused orthodontists, the reason even they always want to pull wisdom teeth, even if they're erupting decent, like assuming they're not coming in like at a 90-degree angle,
right.
If they're coming in decent, they still want to pull them. I think it's because it's a liability thing. Because like if wisdom teeth get infected, if they cause an infection in your face, technically that can kill you, because like any infection that close to the brain is very dangerous.
Right.
So I'm pretty sure that just to protect their own ass from a future lawsuit, in the 1 in 100,000 chance that your decently erupting wisdom teeth are going to cause an infection, they're just like, yep, Bailey, pull them. And then on paper, there's a record of them saying, hey, I told him to pull the wisdom teeth and I did my job. Like, my ass is covered.
Yeah.
I think that's what it's about.
Yeah. And I think it's also like, just as in somebody who's getting my wisdom teeth taken out, it's popular. You see videos of, popular videos of people saying funny shit when they're all doped up after they get their wisdom teeth taken out. You see your friends, in school, all your friends get your wisdom teeth taken out. And you're like, dang, mom and dad, like, I want to get my wisdom teeth taken out, because it's funny, it's cool. Like, it's
a rite of passage.
Exactly. Yeah. It's just what you're supposed to do. And nobody really
right.
asks questions of like, why? Why do we have to take them out? And
right.
you ask,
but in actuality, those big fat ass wisdom teeth are giving you like 8 millimeters of fucking forward support, and when you pull those,
yup, exactly. So when you look up on YouTube, or on Google, mostly videos on YouTube, and you look up pros and cons of getting your wisdom teeth taken out, they do not mention anything about your airway or facial profile.
No, you got to come to JawHacks for that information.
Exactly, man. Like, it's just, it's so wrong that it is not accepted that retraction or extraction has any impact on your airway or a correlation with your airway. They like to say there's not enough
research. The wicked will always rule,
research.
man. The wicked will always rule. This is the way the world works, my man. The world is perpetually in darkness. Truth is always swimming upstream. And you will see when it comes to almost every aspect of life, this is the case. You're getting blackpilled right now on dentistry and on health in general, because believe me, this applies to almost every aspect of health as well. It applies to diet. It applies to mental health. It applies to, you name it, man. Orthodontics is a great entryway into understanding the reality of the world that we live in, but you have to acknowledge that this is just the way it's going to be, and you have to be your own advocate with regards to everything in life, because if you follow conventional wisdom, that is a one-way ticket to hell.
Yeah. It's just I saw this statistic the other day. 5 million Americans got their wisdom teeth pulled last year. $3 billion to the dental industry because of those 5 million. Like, it is such like a business. Like, they do not care. They do not give a single fuck if you have them or not. Like, of course they're just going to find, like, it's like a blanket. Everything is just covered. So, you know, sleep apnea is one of the most undiagnosed things that somebody can have. You know, I think it's like 80% of people with sleep apnea don't even know they have it. Like, they're so protected. They're just like a step ahead with just like, it's sad, man.
Doctors are so ignorant that if you were as a healthy looking young man who wasn't overweight, if you went to 9 out of 10 doctors and were like, hey man, I'm having trouble sleeping, like, can you test me for sleep apnea? They would be like, well, Bailey, you're not overweight and you're not older, and so I don't think there's any reason to think that you have sleep apnea. Yeah. That's how dumb they are.
Yeah.
They think you have to be fat to have sleep apnea.
But, you know, I'm not sure if you can see.
I see red.
Would that be considered sleep apnea?
It's sleep disordered breathing,
of course. There's central sleep apnea, obstructive sleep apnea. Like, there's so many factors that go into this, and I feel like if I know these dentists and orthodontists go to school for 6 to 12 years. So if somebody approaches them with, you know, literal proof about what's going on that directly goes against what they practice, they're gonna look at you like, man, get the fuck out of here, bro. Like, I'm not gonna sit here and let some kid tell me, you know, what is right and what's wrong. So when I approached my orthodontist about this and basically did a presentation about what was, you know, going on and what happened to me, he said, bullshit. He said, that didn't happen. He's like, you're dismissed from my practice. He said, I dare. So I was like, sir, like, this is so weird, because I finally found an orthodontist down here, because I'd met with, at that point, 7 orthodontists down here, trying to find somebody to, you know, figure this out. Because at that point, I was like, oh, I need a tooth-borne appliance. Because at that point, I didn't really think I needed an MSE or, you know, surgery. I was trying to stay away from anything surgically assisted. Because that's the iceberg. Exactly. That's the iceberg. I feel like once you find any correlation with the airway, it's like, oh, tooth-borne appliance, because Mike Mew's the most popular. So, of course, you're going to look at the Homeo block. You're going to look at these tooth-borne appliances. You're going to say, oh, well, that's what I need. And then you hear anything about surgery, you're like, no, no, I don't need that.
Yeah.
But, like, tooth-borne appliances, you know, like you say, it's like the sauce, man. It's not like the meat. So you really, like, and tooth-borne are more invasive than bone-borne, like you were saying. So it's, once you get to that point where it's like, okay, it's not just a tooth-borne appliance. If you want to achieve true expansion, you need an MSC. You need some sort of, you know. So when I was,
it's bone stupid. That's how I summarize it. It's bone stupid.
So when I was approaching these orthodontists, I'd finally found one, and I was speaking to her, and it should not have taken me that long to find somebody who was willing to do this with me. And it was extremely discouraging. You know, it took a lot of time, took a lot of money to find someone who was actually like, you're not crazy, you know? So it was just, it was very wild. I couldn't imagine a mother or a father, you know, working full time, you know, doesn't really have the time to go out to all these orthodontists who have, you know, had extractions and retraction done when they were younger, and they're trying to reverse this, or they're trying to find somebody to achieve protraction or expansion of the airway in the maxilla. Like, they're gonna look at them like they're crazy. Like, just go get surgery. What, 40 grand, 60 grand worth of surgery? Like, I don't want to do that. Like, there are alternatives, and of course they want to just jump to, oh, well, if you want to fix anything about that, you need surgery. But it's like, no, like, you it's just crazy, man. It's wild. You already know. But.
Yeah, I do. So where are you at now? Like, so who's this? What's going on with this female orthodontist? Like, is she taking care of you? Like, what's the plan?
So I was with her, and at that time, she wanted to give me a tooth-borne expander, and she checked me for a tongue tie. She said I had a slight tongue tie, and she wanted to proceed with a frenectomy. But at the time, I didn't really want the frenectomy. I just didn't really want the surgery. I was like, I'm all right. Can we skip the frenectomy and just go straight to the tooth-borne appliance or the headgear? Or at that time, I didn't really know of MSC. I was just like, can we just go straight to this, because I'm not really comfortable with surgery? And she was like, no, you can't change it. There's nothing we can really do. We can't proceed with this. So I was just like, all right, well, I'm not going to do business with you if you're not going to respect that it's my body and I don't want the surgery. So finally found it after about 3 or 4 consultations. After that, I found another man, Dr. Quintero. He was willing to help me. I told him about my problem and with what happened at my previous orthodontist, and he said, okay, let me check you out. I'll see what's up. So he did. I got my x-rays and everything, and I told him what I thought I needed, and he was like, no, man, I don't really think you need any expansion. And I was like, what? Like, I don't really, I don't get it. But he was like, well, your teeth look fine, your bite looks fine. And I was like, oh my fucking God. Like, I know, I know it's not crazy. So what I think is a big misconception with the diagnosis of a class 2 through a class 3 is how the teeth touch, not where the jaw is in relation to it. So my jaw could be here. This feels comfortable. I immediately, when I bring my jaw slightly forward, feel a release of pressure in my ears, my eustachian tubes, I'm assuming, and popping. And when that happens, of course, my tongue is going to come a bit forward. And I feel like this. So this is a class 2. This is a class 3.
No, you're in a class 3.
So I have a class 3. But if I do this to any orthodontist, what are they going to say?
Nice bite.
Yeah, right.
You don't need help. Your bite's perfect.
Exactly. So
they don't look at the fact that it's your teeth forcing your lower jaw into a recessed position. Extremely common, man. That's an extremely common problem that people have.
A crazy thing is, I was digging on the internet trying to find anything, and I found a analysis of the orthodontic and dental indices that is used to teach orthodontists and dentists how to diagnose class 2s and class 3s. And she was a orthodontist, and she was basically picking apart the index of what is used, and the studies that they still use to this day are from the late 1950s. Like, is wild. Like, I can
it's ass backwards.
So that's literal. Like, how are they not improving or trying to update the research or update how they diagnose? They say, okay, if you look at this picture on a scale of 1 to 10, what would you say the occlusion is? What? Like, we are in 2022. Like, we have the technology to determine a class 2 to a class 3, and they're still teaching people to look at it. That's bias. There are literal bias in the ways they're teaching people. Like, that's absurd. That's absolutely
they're entrenched. They've got a system, and it's set up, and it works. The world keeps turning. They keep churning out patients with straight teeth and with apparently good-looking smiles and bites. Meanwhile, fucking sleep apnea is at an all-time high. Addiction is at an all-time high. Mental health is at an all-time low. And people are more fucked than ever. And we have the orthodontic industry just, resting on the freaking laurels of their 1959 research regarding, what counts as a good bite. It's messed up, man. It's messed up. I know.
So, I also think that because of the force that was applied to here, it was, since these teeth were being brought back, it was bringing, because there's a rubber band from here to here, so it's bringing this jaw forward. Because if you look at it, it's this and this. Like, imagine this is an arrow, so it's like this. So when that happens, it's tipping these bottom teeth. And I have now, like, a dent here. Like,
you lost profile.
Exactly. So, like, all in here, there's, like, nothing. Like, it's so weird. Like, it's extremely weird. And that must be because of the teeth's influence in positioning on the rest of the face. And that, to me, is wild. Like, that's...
The teeth provide support to the lips. And if you pull the teeth back, the lips are going to flatten.
Of course. And I think
pretty simple, man. It's not rocket science.
Yeah.
And maybe some bone recession, like you were just saying.
Exactly.
Some bone loss.
Yeah. And to, like, reverse that, like, how would you reverse bone loss?
A bone graft. That's it. It's the only way. Bone doesn't grow unless you cut the gums open and you stuff it in. You got to stuff in freaking cow bone.
So this is literally irreversible damage caused by my orthodontist.
Correct. Yep. And almost all orthodontic damage is irreversible. Yeah. Go ahead. Finish your thought.
So now it's like, well, what do I do? How do I, reverse this? I want justice. Like, I don't want this orthodontist to continue to do this to people from where I'm from. Like, these are future doctors, future surgeons, future artists. Like, these are people who could change the world, and they're being constricted and restrained because of an orthodontic treatment that's prehistoric. And there are
mutilated.
They're
being mutilated.
Exactly. And there are other orthodontist doctors out there that do this and expand rather than retracting. So it's like, okay, lawsuit. Like, what about now? What about a class action? Because if they're doing it to me and they did it to my sister, they're doing it to thousands of other people. They're like, this is so much bigger than I feel like a lot of people realize or think it is, because this feels illegal. Like, I feel like.
So let me double black pill you on that. So in the 80s, and the name of the case escapes me, but in the 80s, there was a woman who had orthodontics, had extractions and retraction, developed TMJ issues, and sued her orthodontist, blaming the orthodontist for causing her TMJ issues with the extractions. She won the lawsuit. In response to that, this is like a groundbreaking case. In response to that, the orthodontic establishment spent the next 10 years working together to fabricate research that proved that orthodontics, traditionally done, i.e. extract, retract, straighten, cannot cause TMJ and cannot otherwise do harm. They literally, in response to that lawsuit, rather than doing some soul searching and being like, yeah, we've been kind of fucking it up, instead of doing that, they doubled down and they produced a propaganda campaign, more or less, to defend themselves. Now, if you try to sue an orthodontist for extract and retract, how does a lawsuit work? Well, the judge wants an expert opinion. What does the evidence say? What's the standard of care? The standard of care. If you violate the standard of care and you've caused damage, then there's been damages done and the plaintiff is entitled to settlement or whatever, to collecting money. But if the standard of care, if you ask 10 chairs of orthodontics at 10 major American dental schools what the standard of care is, and they all say the standard of care is to extract, retract, this can't cause damage, this study, that study, this study, all from the 90s, from these top universities, then the judge is going to be like, well, all these top doctors say that it can't possibly cause damage. Maybe you're crazy.
Yep.
And so they've defended themselves.
Exactly.
They've built a fortress of propagandized research supporting their extract and retract methods. So you're not going to sue and win on that one.
That's so wild that you say that, because I discovered that myself as well. Because I was looking at all the research, and I was like, there's one specifically about patients who have had extractions and patients that have OSA. And what they did was they looked at a medical chart that people who were diagnosed with sleep apnea and people who had extractions. They didn't take into account that people most likely don't have a diagnosis of sleep apnea. So all they did was they look at the chart and they said, well, it says here that this and it says here that this, so no, there's no correlation. That paper was cited by 36 people.
Yeah.
36
Trust the science,
doctors.
bro.
Like, that
Trust
is,
the science.
That's crazy. Like, it's like I have to read between the lines of research. And when I was talking to my orthodontist about this, when I approached him about, what happened, he was like, oh no, there is no correlation, don't teach me how to do my job. And I was like, sir, like, come on, like, I really need, like, I found somebody who is saying otherwise. I'm showing you proof, like literal proof of what has happened to me. And he was just like, let me tell you something. He was like, I'm the bigger man. He was like, don't you ever take on the bigger man. He's like, you will always lose. And then he looked at me and he said, you're dismissed from my practice. He said, I dare you to try and sue me.
Wow.
I didn't even mention anything about malpractice. I was like, so like that to me was really discouraging, because
fuck that guy,
bro, fucking douche. And he has like he literally has a monopoly. Yeah, right.
Yeah.
He has a monopoly in Raleigh, which is the capital of North Carolina. He has 3, like, he's like the most popular orthodontist. I don't want to say his name, but like he's the most popular orthodontist. I know he's giving everybody a universal bite. I know he's doing this to everybody. So if a class action really does happen and they put out, you know, a study or a survey of, and you go and get a sleep study done, and you know this does go to court, and there are 1,000, 2,000 people with the exact same case, how's that gonna hold up? They're gonna bring in and say, oh well, this is a standard of care. Well, what if I bring in Rebecca Bacau? What if I bring in any of these doctors who go to these meetings where they they prove that there is a correlation between retraction and the airway? So like that to me is like a big what if. Like what if that really does happen? You know, that could really revolutionize, that could really change, you know, the industry. What if a lawsuit like that goes through? You know, what if
Bro.
you know, it is one and all these people, you know, I don't give a fuck about the money. I just want it to be right. I don't want this to continue to happen to people, you know, little children who this is happening to, you know, future. Like it's sad. It's really, really sad. So,
Bro, you're spitting fire right now. And look, I agree with you that the science is on your side. And in every revolution, there's one man with a vision. And it sounds like you have the vision. You got the fire. I support you. What else can I say? You're right. You're 100,000% right. You know?
It's good to hear you say that, man, because hearing all these doctors tell me I'm wrong is very demoralizing.
Yeah. Never trust a doctor, man. Never trust a doctor. Honestly, the fact that they're sometimes the smartest people are the dumbest people. That's another thing I've learned over my 20s. Sometimes the smartest people are the dumbest people. Right? I mean, think about who's actually chucking premolars. I mean, yeah, premolars and wisdoms. It's oral surgeons. Oral surgeons are the most highly trained doctors on the planet. They have to go to dental school and medical school before they can become oral surgeons. And those are the guys that are actually doing the crime. They're pulling the trigger.
Yeah.
So literally the smartest are the dumbest.
And like that makes sense that you say that, because like I mentioned earlier, like if you go to school for something and learn something for, you know, you devote a decade of your life to do something as I'm kind of all over the place. You devote this much time and money into something, and you learn all of this false information and you're backed by this whole group. What would incline you to go against that? You know,
You wouldn't.
Like you're like, no, I'm
it's
already
peer
hundreds
pressure.
of thousands of dollars into debt about this. Like, there's no way I'm gonna go against it. You know, but if somebody like me or somebody like you or anybody who this has happened to, they start reading between the lines because they don't have any sort of bias, and they start like, oh man, like this is real. You know, like then what? You know, like it may take one person like yourself to really push this and make this popular, you know, really pop off. Like I see you are the pioneer for this, man. Like you dead ass started all of this. I see you in a year, 2 years, 3 years from now having 100K, 500K, a million, and this becomes like nationwide popularized thing. Like this is revolutionary in my opinion.
A movement.
I think exactly. I think what you're doing is phenomenal. I think the work you're doing, the research you've done, having me on, having these doctors on, like you are providing the between the lines. You're making it bigger for people like myself to see. For people, you know, who come across on YouTube, this may be recommended to them, or you know, anything else, and they start doing it, and then 5 years from now they become an orthodontist or a dentist, and then 10, 20 years from now everything changes. There's a flip. You know, this becomes on the news. This is extremely much bigger than, you know, what it is right now. Like things like that happen. You know, like you mentioned before, one time you said like cigarettes. You know, doctors were prescribing cigarettes. You know, like that to me is wild. And they perform lobotomies. You know, your arm, you had an infection in your hand, they just immediately cut it off. Like this to me, like we are in a barbaric moment for orthodontics. Oh, you want to deal with your airway, go see an ENT. You know, but it's like, why? Like you should know that if you're doing something that affects my airway, affects my facial profile, you should be educated enough to know what the fuck you're gonna do, or at least technology should be available for them to rely on to determine what they're going to do, rather than just being like, yep, if we overcorrect you by retracting, it's not our fault, it's no big deal, you know, there's no point. Like it's logic. Like they don't want to listen to it. So I really think this is much bigger than, I don't know, I believe that
It's huge.
yeah.
it's a public health crisis. It's a great social injustice. It's pre-Ptolemaic astronomy. It's ass backwards. It's barbaric. You're right about everything, man, and it's happening as we speak.
Yeah.
Like you said, what 5,000 people got their third molars chucked last year? Yeah, I don't know. I don't know. 5 million. 5 million. Jesus, 5 million. Bro, I hope you're right. And if there's some small role I can play in that, I'm willing. And I really encourage any young people listening who are unsure about what to do with their lives, because so many people don't know what to do with their lives. Become a dentist. Make money. Go to a state school if you got one. Florida has a state school, I think right in Gainesville. And, they've got a dental school. Maybe that's not for you, but people should go to dental school, man, and they should be part of the change, because ultimately it does, need to happen from the inside too.
Yeah.
Right? And everyone needs a job and everyone needs a career and a purpose. So I almost went to dental school. Wasn't for me, but maybe it's for someone else out there, man.
Yeah.
As for you, bro, what about you? Like, what's your plan?
I've thought about it, maybe later on in life, but that's just not really something that I'm interested in pursuing as a career. But it's definitely something that interests me. I don't know if you can tell. But
it does, but you seem like more of an influencer rather than someone who's in a practice all day dealing with people one-on-one. You're an artist, and you're a creative, and you're an excellent communicator, and you're a handsome guy, if I can say so myself.
Come on
so
now, Big Ron, that's all you, bro. You the ultimate Giga Chat right here, bro.
Nah, bro. You're mogging me right now. Are you kidding me, bro? You're owning this shit. So I think, I'm really excited to see what's going to come of you with regards to all this too. You're a warrior, bro. You're a warrior. You spit fire.
Bro, so do you, man. If it wasn't for you, I would not, be saying what I did. You really connected the dots for this. Because there was a period where, I was so hell-bent on the homeo block. I would walk into an orthodontist to say, do you provide a homeo block? They say, no. And I say, all right, well, bye. I wouldn't really say, oh, do you provide MSC? Because right now, that's what I need. A homeo block's only going to do so much. There's only so much tipping the teeth out can do. Your tongue has great influence on the soft tissue and maybe, the bone, but I'm not sure how much the tongue can really do to fix, something that as severe as mine or as severe as somebody else's, where they were overcorrected or they had more extractions than me. There's only so much the tongue can do, and there's only so much tipping the teeth can do. At some point, you have to know MSE or any other, that is provided. And I do.
You're right, bro. You're right. It sounds like you understand every point that I've ever made on my channel, bro. You're like my top student,
bro.
Not that I'm a teacher. I'm not a teacher,
no,
but
you really are.
You've mastered the channel. You get it. You get it,
man. So I one thing I want to talk about too was Facemask, crane face mask, and MSC, and also Invisalign, and the lack of biting force, because you can't really chew with Invisalign. Because the plastic, it just is uncomfortable. So I really feel like Invisalign should be used for short-term treatments rather than using Invisalign to treat braces. Because if you have Invisalign in for a year and a half, 2 years, you're not chewing or you're not biting down for 22 hours, sometimes 23 hours a day. What kind of effects does that have on bone loss? Because if you're not stimulating the teeth by biting, then the bone is going to recess. These muscles aren't going to be used as much. It's gotten to the point where I look at people with Invisalign that I've known for a couple years, and I can see a difference in them. This whole shit has made me look at people so differently. It's so it's annoying, but I don't know, it's cool. But
that's an interesting point you're making, man. I'll add to it. So ironically, regular braces on the front of your teeth are the most minimalist, mewing positive type of system that you can have. I've had it all. I've had braces, I've had Invisalign, and right now I have braces on the inside of my teeth called Brius. And sure, I can bite with these, but it's hard to mew with them because they're on the inside of your teeth. So if you try to work your tongue, you're hitting metal. So ironically, the oldest, most basic system, which is regular front lingual braces, I'm sorry, buccal braces on the outside of your teeth.
Mm-hmm.
That's the system that allows the most function during treatment. It's a really interesting point you make.
Yeah, because like with Invisalign, like there was a video you made where you were talking about mewing with Invisalign and how difficult it was to hold the suction mew because your lips were getting caught, and that would happen to me too, and that was wild. So it's crazy, like you said, it's very ironic, but
Yeah, for sure. And yeah, like, you know, another thing about Invisalign that you notice, you'll never chew gum with Invisalign because they're just in, and like to chew gum, you got to take them out, and then taking them out is kind of nasty, and so you just end up not chewing gum, and you just like literally you only use your teeth when you're eating.
Yep, and that's
an hour a day.
And like looking back on it, like I would see pictures from when I was 15, 16, and how much wider and fuller my face was. And then when I started wearing my Invisalign, and I started noticing my face became much thinner, and I was like, that's so weird. I just assumed it was because I was getting older. You know, you're growing, your face does change. But I do feel like genetics and habits are maybe, I'm not really sure, but they're up there. It's not one or the other. Like you would approach a doctor and they would ask, they say, oh, it's just genetics. You know, like they don't really take the time to look at it as, you know, where it is rather than black and white. Like it's wild.
Yeah, it's definitely both, and actually they intertwine through the phenomenon known as epigenetics, where environmental cues actually can affect genomic expression. So we know that they're intertwined, you know. But you were about to ask me about MSC and Facemask. Like, so what are you thinking for yourself? Are you looking for a doctor in Florida? Are you trying to get treated? I
am, and I believe you provide an MSC provider. But I am looking for an MSC provider. I do think, ideally, ease to expand, and then MSC for screws, not to expand, but just to attach to the maxilla to protract. And then I would obviously need to expand the mandible, so Dame for that, but I'm not sure how much that would cost. I'm assuming probably anywhere from 30 to 40 total. But
yeah, man, if you start talking ease and Dame, you know, first of all, you're only getting ease done with one guy. That's Casey Lee.
Yeah,
that's going to be 30 to 40 right there, plus commuting to California. Then if you want a hopscotch from Casey Lee to Yusefian to do Dame, that's a whole other thing. And then you gotta hope he'll take you on after you've already been treated by someone else.
Yep.
And now you're talking commuting to freaking Seattle, Washington, 20 times over 2 years. That's a lot, bro. That's more in travel expenses than it is in treatment costs.
Right.
So
that was just like
that's the ideal though.
Which is
no, you're a brilliant guy, and so you've basically crafted in your mind, logically speaking, on paper, what is the best possible treatment plan for me. And I would agree. Ease is great. Mandibular expansion is awesome to complement maxillary expansion. And then whatever you can do to protract, the more the merrier. If we can avoid double jaw surgery, great.
Yeah.
So, interestingly, man, the person I will refer you to is Dr. Zubad Nawaz. He's in Jacksonville. So you could drive a couple hours up the coast and see him. And I don't know for sure, but I know that he is very open to mandibular expansion. I don't know if he's done it yet. I think he probably has, but he is very much like, you might be able to get MSc and MSDO in state with Zubad Nawaz. And I can guarantee you that you will have a philosophical friend in him. He will not judge you for your philosophical orthodontic ideas. He is definitely a like mind.
Yeah.
So there will be no resistance there, man. That would be someone that maybe you won't, I don't know exactly what you'll do, but he would be a great next step for you in terms of making a connection, having someone take a look at you, having someone validate your hypotheses.
Because at this point, I feel lost, man. Like, I really, I've visited every single orthodontist 45 minutes, an hour, north, south. it's crazy. Like
Yeah.
for everybody to say, oh, you're wrong. Like I can't imagine like living in like a small town, you know, and this happening to you, or you're much younger than I am, 15, 16, 17, and you're watching this, you know, channel, or you've become aware of like what's going on, and you have braces, and your orthodontist is telling you, no, you know, we're not going to do this, and your parents aren't really listening to you. Like I couldn't imagine like being stuck in that hell, you know, because that's what it is. Like you literally are aware that negative health is being imposed onto you. Like,
yeah,
it's sad.
You know what really kills me, man? When I talk to people overseas, guys in India.
Yeah.
Oh, dude, India. That's the one that kills me. Because first of all, these guys cough up whatever, $100 to talk to me, right? And I don't even know what it takes to make $100 in India, but I guarantee you it takes a while. But anyway, they sign up for a chat. Now I'm talking to a guy from India. He's got all these issues, and he's like, you know, so what can I do about it? And I'm like, I don't know, bro. Can you fly to America for 2 years straight? Yeah. And it's just like, no. And then it's like, I don't know, bro. I don't know what you can do about it. Get double jaw, like there's double jaw surgeons in India. Like that's kind of like it for a lot of people. There's no MSc guy, but there's always an orthodontic surgeon. But then it's like, that's what you're doing,
right? And
you're hoping for the best,
right? And a lot of the research I found were from people in India, which I thought was ironic. Like I thought it was, you know, I thought it was cool because like it must be a serious problem in India, you know, to the point where this was occurring maybe 20 years ago, 15 years ago, to now where they're at the point where they've done the research, you know, they performed studies and they're putting it and publishing it out. So I thought that was cool. But
yeah. Well, Indians are brilliant, man, and they're master. They have a tremendous culture around engineering and around technical stuff. Very, very rational culture, and it's also a culture that has a lot of ancient wisdom around, you know, energy, breath energy, and meditation. And so I don't know, maybe that all connects. I mean, the Buddha was actually not born in India; he was born in Nepal, but you know. He practiced in India. India's a weird place. You know, a lot of American tech CEOs are Indian. I don't think that's a coincidence. They say Indian technical schools like completely shit on American technical schools, including MIT and Caltech. Like it's a whole nother level there, man. Yeah. So, and this isn't that hard of a problem.
Yeah.
Bro, you're 20 and you're a rapper. Like you're a 20-year-old rapper in Miami, and you've fucking figured this out.
I just feel like
first of all,
crazy.
you're brilliant. Like, don't get me wrong, but I'm saying you don't need to go to Indian technical schools to understand that retracting jaws is trouble.
Right.
You know.
Yeah. I guess another question I have is like insurance, because I you know, I'm only 20, man.
That sucks. Insurance sucks.
So, like, how would they are they inclined to cover MSc? Are they inclined to like? How does that work?
No,
They
don't cover orthodontics. Sometimes a person's insurance allows one lifetime treatment of orthodontics, but usually people have had that in their childhood.
Yeah.
Like you already had.
That's how they get you.
You already had your orthodontics. Yeah, but yeah, you're gonna have to come up with some dough to do this, bro. You're gonna probably have to come up with $2,000 to $3,000 down payment, and then you're gonna have to make a couple $100 a month payment for a couple years to pay it off. So yeah,
which is where I'm expensive. At right now to do. So like it's just, but still, you know, like sucks. I feel for the people who don't have the resources to, you know, do something like this and like that.
Yeah,
that
the 15-year-olds who are in school, they can't work because they're in school.
Exactly.
Yeah, no, I do too, man. I know it sucks, man. You know, there's a lot of suffering in life.
Yeah. Another thing is how this has affected my speech. I know this is like very obvious, but to somebody who could just be stumbling upon this, my S's, my F, my V, my P, you know, of course, and then, you know, you would have to do myofunctional therapy to like, you know, do this or help it. But, you know, I'm a rapper. I record hours a day, 2-3 hours a day. I'm all the time. I know how the tongue strikes the like, it's all like, it feels so back, and I've noticed changes in my voice as well. the hyoid bone. I really believe the positioning of the hyoid bone has an effect on your voice. And I also think, because the voice doesn't just come out of here. It comes out of your nose, like it comes out of everywhere. Well, your mouth and your nose. So I feel like if you're constricting, or if this is changed and this is changed, like that's an obvious change to your voice. So for that to not even be taken into account is like, again, just extremely frustrating.
Yeah. No, all they're looking at is the straightness of your teeth. But you're right. I think it does affect all that, and I don't think it's an accident that a lot of the true gigachads out there, they have remarkable facial structure, and they've got deep resonating voices that just scream of power.
Right, like athletes.
Athletes, yeah. All they just say one word and it just vibrates the whole room with its power.
Yeah.
It's not always like that, but yeah. No, the bigger your think about it, the bigger the wind instrument, the more noise it can make, right? So yeah, so is your art struggling because of the effect this has had on your ability to be lyrical?
Yeah, I mean it really, because you have an eye for certain sounds, especially when you're recording. You could record a certain word or a certain line 4, 5, 6, 7 times because you're trying to get the pronunciation right or the tone of your voice right. So now when I am recording and I'm trying to do it, my mind is thinking basics like muscle memory, but it's coming out wrong. So you're
stumbling. Yeah,
exactly. So it is very discouraging. It's very annoying. I haven't posted on Instagram. I haven't posted music. Like it goes deeper than just my teeth. It goes, like we were talking about earlier, mental health. Like this has really, really, really affected me. And another thing is I've been struggling with is finding like self-love out of all of this, trying to accept, this is where I am right now, and I'm working towards trying to change this, but accept where I am and love where I am, rather than not giving up, but allowing this to define me or dictate my life and my actions. There was a woman on YouTube who I don't really know her name. I think it was like Danielle something, and she had posted about a year or two ago about trying to reverse her retraction and how
Danielle Holland.
I believe so. Yeah,
she's been around for a while. She's awesome.
And she was talking about it, and one video that I found was really eye-opening was her self-love. I think it was like a couple months ago. She posted about trying to accept where she is and finding self-love and everything. And I feel like that's really important for anybody who's struggling with something like this, is not letting it define you, not letting it debilitate you to the point where you can't go to work on time, or you can't turn in work, schoolwork on time, or you're letting it affect your confidence, or letting it affect your relationships, because it goes very deep, man. It really does.
Yeah, it does, man. It does. I struggled a lot with that, especially because I've been in orthodontics for 6 years now as a 26 to 32-year-old. So, when you're a man, like when you're a 30-year-old, you're not supposed to have braces, and you're not supposed to be dealing with this shit, right?
Right.
Like, you're supposed to have a house and a career and money and confidence. You're supposed to be a man.
Yeah.
So I had braces from age 26 to whatever, and not to mention my fucking, like, my teeth were all fucked up at one point, and they were all fucking protruded forward and flared out and shit.
Right.
And like, so one thing I learned was that, so here's what I told myself. I was like, look, if I can be confident like this, then when I get this fixed, and I will get this fixed, I'm going to be Superman.
Right.
Because like, if I can run with crutches on like Forrest Gump, then when those things come off, I'm going to fly.
Yeah, I'm gone.
So I like tricked myself. I was like, okay, so I have every reason in the world to not be confident. And if I'm not confident, everyone understands, because I'm the dude with the braces.
Right.
But so let me just experiment. Like, let me just play a game with myself and try to smile big, even though my teeth are fucked up.
Right.
And because what you realize is, like, it's not that your teeth are fucked that makes your smile bad. It's the fact that you feel like your teeth are fucked. And people feel that when you smile.
Right.
They feel the vibe of like a lot of times people with bad smiles, they go,
yeah.
or they go,
yeah, they don't really like to show it, or they smile with like this rather than showing their teeth.
They smile half-ass. Yeah, exactly. They hide it, but it's a vibe thing.
Yeah.
And humans read vibe. Humans read body language.
Yep.
You could have a dude who has rank-ass teeth, and a lot of people do, but they smile big because they're just ignorant of it, like they're just not self-aware enough to know how bad their teeth are.
Right.
But it works.
Yeah.
Because they put it out there,
Mm-hmm.
and it could be rotten, it could be dirty, it could be canted, it could be whatever, but people are still like, oh, that dude, his teeth are bunk, but he smiles big. He must have something going on.
Yeah.
Like, he must have something figured out. That's what you got to get to.
Like, fake it till you make it, basically. That's all confidence is, man.
For sure. And the other thing to keep in mind is, like, you're never going to be perfect.
Nope.
And as soon as your teeth get fixed, and this is kind of grim, but as soon as your teeth get fixed, maybe you'll get fucking, I don't know, maybe you're going to get in an accident and you're going to become a cripple. Right?
I've thought about that.
And so then what? So are you just going to, like, there's always going to be something. So eventually you have to realize that the body is just the body, and it's always going to have its issues.
Yeah.
This is kind of Buddhist wisdom. It's just the body, man. It's a rotting piece of meat.
Yep.
In Arabic they say, "Kitlat lahm bidun milh." That means the body is a lump of unsalted meat. It's just rotting. And if you can just have that kind of detachment from your body and just live happy in spite of your bodily imperfections and your illness, that's next level wisdom.
Yeah. Wow. I feel like I've heard you say that before.
It's a very Buddhist idea, and I have a lot of training in that. So we used to do a lot of body contemplation at the monastery. You literally meditate on your own decaying corpse. I know that sounds fucked, but like that's a big part of Buddhist training is like contemplating the impermanence of the physical body.
Yeah.
So, yeah.
Yeah, it's good to like talk about this because it's hard as a man to really deal with something that can be perceived as so insignificant, and it be so significant to you. And
Yeah.
like you said, like changing your mindset is one of the most important things you can do, especially not even just referring to this, this is nothing compared to people with cancer, people who don't have a home, people don't have, family, like I'm very fortunate for the things I have and for the position I'm in. So for me, sometimes I catch myself thinking, oh man, I'm down bad, but then I catch myself and I'm like, what the fuck is wrong with you, man? Like, look around, change the way you think. What you think is what you are. This could be so much worse. I could be, I could have been burned. I could have been a burn victim. My skin be terrible. I could not be able to walk. There are people out there who still go to the gym in wheelchairs, and it's just changing the way you think, and that is very important to your mental health as well, especially dealing with something so significant.
Yeah, and not to minimize your issues, but just because I talk to people all the time,
Right.
And they ask me to like judge their physical appearance.
Yeah.
Like, dude, you're better looking than 95 out of 100 guys, maybe 97 or 98. No, and obviously, no, but it's a fact. So you have no reason to, like.
Thank you, bro.
Just keep that in mind. Remember I said that, and believe me, I judge male aesthetics for a living. That's a part of what I do. So, but not to minimize, but you should have no problem going through the world feeling like a fucking Chad. Right. Because you are, bro. You're a fucking Chad.
And anybody can be a Chad. It's like we were just talking about. It's all confidence, man. Like that's all it comes down to is how you live your life. But yeah,
I'm a red pill guy myself, so I would agree with that. But I'm not even talking red pill with you, even though you do have a lot of confidence. I'm talking just straight up like physical appearance. Man. You're top level.
Thank you, man.
So don't get too down on yourself, because even though you feel mutilated, and in some way you are, and I agree your function is all fucked up because of your bite and stuff, but like you're definitely good looking enough to do pretty much whatever you want in life.
For sure. And yeah. I feel like that is plays a big role in, you know, the mental aspect of everything. But the one thing that really fucks with me is the mental aspect of, you know, there's been times where I would go to, you know, try to go to sleep, and a thought would pop in my head where it would be, you're going to suffer irreversible brain damage before you, like, when you sleep tonight, because your airway is restricted. And now I believe I have central sleep apnea, which is when your nervous system doesn't make you breathe as often or as deep. And like, that to me, it scares me. Like, it really scares me, because I'm suffering irreversible, permanent brain damage to my temporal lobes, which directly affects my ability to detect pitch, speak, move. Like, these are all things that have to do with my career and what I'm trying to do.
Rhyme.
Yeah, exactly.
Rhyme.
So like, it is so scary sometimes. That's what worries me the most, my health, rather, you know.
I hear you, man.
It's
so you know, fix it. Fucking do something about it.
exactly
Right? And you know what to do. Just a matter of executing. Also, you're not, like, don't feel like you're dying every night. Like, the body is way more durable than you think.
right.
So if you have to deal with this for a couple years before you can come up with the money or whatever to get treated, not a big deal, man.
Right.
Not a big, like, I know, like, it's not perfect, but you can get through it. Don't the Buddha used to say, suffering is like, so there's a difference between pain and suffering. I agree you have pain, but it sounds like there's also some unnecessary suffering that's coming in, because you're getting hit with the arrow. And then what you're doing is, and the arrow is like your sleep disordered breathing. It sucks. I agree. It's a physical problem. But now what you're doing is you're taking that arrow, you're ripping it out of your ass, and you're stabbing yourself with it over and over again, saying, oh, this is having long-term damage on my brain. This is ruining my career. This is ruining my life. The arrow's in your ass. I agree. Just try not to pull it out and stab yourself with it too many extra times, because that's unnecessary suffering.
Right.
You know? But I'm not trying to fucking patronize you, bro.
No.
You know what's up.
Right. But no, that's exactly what I feel like I'm doing. I've always been very hard on myself. And I feel like you need that to an extent, but when it comes to dealing with things like this or difficult things, I feel like I am a bit too hard on myself, and that really affects
things that are out of your control.
Exactly. Stoicism.
This is not totally in your control right now, right? A little bit of stoicism is called for here.
Yeah.
But also some wise action too, though, because there is ultimately something you can do to get back to even on this.
Yeah. Yeah, and
don't rush into anything.
Yeah.
You know how to determine the right steps from the wrong steps, but there is hope for you, ultimately.
Right. Thank you, by the way. Seriously, I appreciate that.
For sure.
There was one more thing I wanted to talk about, and that is the bite's influence on posture, obviously, but these muscles under here, when this is forward, this is much longer. So I feel like when you bring it back, it constricts it, and it makes it want to go open like this. So one thing I noticed was when I would max out on bench specifically, and I would drive my neck back, my shoulders are back, and I'm going to bench and I'm digging my head into the bench. There would be times where I would strain my neck, and this is about like a year ago, and this continues to happen. But I would strain my neck, like I would pinch it or something. I'd be like, fuck, man, and that used to never happen to me. And for the longest time, I wouldn't realize like why. I just thought I was going too heavy, but I was like, there's no way. But I think there is some sort of correlation between my bite and the injuries of, or more prone to injuries of my neck back here. And that could be to the posture, which I'm attempting to fix, and also the bite. So there's so many factors, man. There's so many factors that play into all of this that I feel like isn't really here. I feel like we are here right now, and this is where it's at. So it's just going to take time for light to be shown onto what is reality and what is real in the science, and we're going to take time for the science to like back everything up. But hearing, it also has an effect on my hearing. For a while, when I would make music, my earbuds, this one, the bass would be good in this one, but this one was broken. So my ear, I would notice I would have like hearing loss in this ear. And I was like, oh, it's just my earbuds. But then I changed the earbuds, and about 2 or 3 months went by, and I noticed like my bite, it was like over here, like to the right. So I feel like when my maxilla was brought back and either rotated or shifted to the left, I feel like it's had an effect on my eustachian tube or some part of my hearing. So I feel like that's pretty interesting as well. Another thing is like the size of my nose. I feel like there's a lot of soft tissue here than in comparison to what it was before. Can I share my screen again?
Absolutely.
Okay.
Go for it.
Can you see?
Mm-hmm.
Okay. There's my tongue tie. Anyways, so here's my x-ray. This is before I started my Invisalign. This is April 22nd of 2019, and I think this is I think this is actually September. But anyways, you can see a lot of a significant difference in the soft tissue, my like here in comparison to here. Like, look how much room there is. Look at my teeth. And I feel like my airway is the biggest difference, like in the positioning of my hyoid bone. Look how much further down this is in comparison to this. And I feel like this part of my mandible has recessed because of the backwards motion of this and the forwards motion of this. I feel like has tipped my teeth and has then caused sort of a recession in this bone. So I feel like that's pretty interesting. I know it's not, maybe as significant, but, to anybody else looking for comparison, or if this has happened to you, like these are some of the things that I've noticed to myself that you could possibly notice in your case. And another thing,
bro, what makes your case? Yeah, go ahead, finish.
This is the last thing. Just my posture, like the positioning of my neck is much more curved in comparison to this, and I also think the retraction, in my opinion, the conclusion I've come to was if you over retract, it has more impact on it has more of an impact on the other bones rather than just the maxilla. Because if you look over here, there's more soft tissue of like my brow bone and my cheekbones as well. So I may be exacerbating it, but there is definitely, in my opinion, a correlation, and that could just be for science reasons. But continue.
No, you're incredibly perceptive, and the neck is the first thing I noticed. That's crazy, bro. That's crazy. The way that your neck went from the way Esther Gokhale describes straight, elongated neck posture to more chin-forward head posture.
Yeah.
That's the first thing I noticed, and that right there is your neck pain, your neck strain, your headaches.
Yeah.
Because crunched up in that the second picture of the post-treatment neck posture, crunched up in all there, that also is getting, curved and crunched back here as your spine, as you go like this. All those muscles in the occipital nerves, right? Because at the back of your neck, you have your greater, lesser, and third occipital nerves. They're little peripheral nerves that run up the back of your neck. And when you have bad neck posture, those get shit mixed. And you get headaches super easy right at the back of your neck because you're always in bad head posture.
Yeah.
And I've had 2 surgeries on the back of my neck just ripping nerves out because my occipital neuralgia is so bad. What I wanted to say about your case is it's so interesting and unique that this happened to you relatively late in life. For most people, what happened to you happens when they're prepubescent. So they don't have the before and afters like
right.
You have. Your before and afters are striking. They're absolutely striking. Like, because you can see a developed young man at age 18
17,
or
18.
whatever, 17, and then and at that point your aesthetics are quite determined. Like, you were a good looking young guy with this structure. You weren't some prepubescent kid,
Right.
some boy. And then you had the treatment from 17, 18, 19, and now this is what you look like as a 19 and 20-year-old, and it's fucking different.
Yep.
In all the ways you just pointed out.
Yeah.
And I agree, they're all real. And some of that analysis I had never even seen before, like the thing about the soft tissue and
Right.
the way the front of your mandible lost profile because the tipping of your the lingual tipping of your lower incisors.
Mm-hmm.
So yeah, man, I feel for you, and it sucks that your youth was kind of derailed by this, but I hope it becomes like a hero's journey for you. You know, the cycle of the hero's journey is man starts in a stable, comfortable place. That's you before treatment. Then the way the hero's journey starts is you get put into a tough situation, right? You get sent out into a struggle. That's you and your treatment and all the shit that's fallen out of that. Now the hero's journey is, okay, how are you gonna deal with this adversity? How are you gonna fix this? How are you gonna take the lessons you learned, and then the last part of the hero's journey is bringing it full circle. You come back to comfort, into strength, into home.
Right.
Except now you're a harder man from what you've been through, and your strength helps you contribute to the world in a profound way.
And that's exactly the route I feel like I want to take, is possibly changing the discourse for the other people, because I know there are other people with the exact same thing that has happened to me. So this is much bigger than just, me. I feel like I have an opportunity, and I'm in a position to, and so are you, to really change the fabric of like what is to be expected by orthodontic treatment, or to reverse this and to make it more common practice and to make it more of an achievable thing. And I want to prevent this from happening to other people. This is possibly minor compared to some other people who have happened to in childhood. Like how the relapse of their teeth and how that has caused root resorption, how that has affected their profile. I feel like you did an interview with somebody who was only using a dental appliance. I think it was like maybe the third or fourth one you did. And he was talking about where he was, and his was much more significant than mine. So like I feel for those people who are just now doing something about it or realizing like what's going on. So I feel like prevention is the cure to everything. So, but at this
100%,
at the same
100%.
time, like you have to know what to do to reverse what has happened. So yeah, man. You're doing God's work.
My niche, I appreciate that. My niche is definitely taking adults who figured out that they got mutilated and then helping them figure out what they can do to try to make it better and to put the fucking Mr. Potato Head back together.
Right.
But really, for large scale change, the better thing to do is to just avoid the need for MSC entirely in surgery. Stop doing this to the kids. Stop pulling their teeth. Leave them alone. Make them bigger. It's easy to make kids bigger.
Yep.
They're soft.
Yep.
They have soft clay. When you get to adults, you're fucked.
Yep.
It's a pain in the ass. Even if you go see Dr. Yousefi and you have the mane and the dame and the perfect expansion, perfect symmetry, the works, right? Come on, how much of a pain in the ass is that?
Yeah.
Like, you're lucky if you can afford it, and if you just so happen to be in the Pacific Northwest, and I know there's other great doctors too, but you know what I'm saying?
Yeah.
But like, what if we could have an orthodontist in every town and every city in America who, if a kid didn't have a perfect upbringing, if they're born not perfectly healthy, the orthodontist, rather than making it worse, takes a kid who's not perfectly developing and makes him better.
Yeah.
Right? Imagine that.
Right. Because this goes much deeper
Imagine
than facial profile. It goes to the development of your brain, the development of your your body, everything. So that is wild. That is, you're completely right. I feel like at some point, it will get to that point, where it's somewhere close to that, if not above that. So I'm very hopeful that the world will change and this will become a more common thing, because there are people out there who promote this. There are very popular YouTubers, the Dentist, these popular orthodontists who answer questions about extractions or retraction, and they do reaction videos to headgear and stuff, and they call it barbaric. They call, you look like Willy Wonka, and they make these jokes. And there was one video by the Dentist where he was like, it was about surgery. It was about jaw surgery, and he was talking about like the pros and cons of jaw surgery, and his only response to, well, jaw surgery makes you smell better. It makes it easier for you to smell. Sorry, it makes you easier for you to smell.
Yeah. I got you. Yeah.
And you kind of have to like think about that. And it's like, well, why wouldn't you say it makes it easier for you to breathe? Like.
Yeah.
I don't know. It's just like, these are popular influencers who have millions of followers, millions of views, millions of likes. Like, that is what people are learning right now. So if you were to ask anyone in that comment section, or those followers or those orthodontists, they're gonna tell you the exact opposite of what we're saying. So like, we're literally at an uphill battle. It's wild.
Yeah. And this is one of the reasons why I'm more of a Christian now than a Buddhist, because Christian spirituality helps you understand this. Christians have this idea that the wicked will always rule, that the truth is always going to be underground. When you look at the Dentist and his dumbass ideas, completely ignorant with regards to all of these health issues that we're talking about, that are everywhere, that are truly pandemic. And he's the dude with millions of followers, right? Meanwhile, Mike Mew is getting his life taken away from him by some kangaroo court, right? This is what Christians are talking about when they say, we're going to be thrown to the wolves.
Yeah.
Right? The darkness is going to rule. And that's just how it is on planet Earth. And that doesn't mean we give up on the truth, but it does just seem to be the way it is, man. Like, it also feeds into the conspiracies that often appear in my comments, and it just makes me believe them.
Yeah.
Like, well, why is this the Dentist who's got these basic upside down ideas? Why is he so popular? Why is the algorithm pumping him out like fucking government cheese?
Because he has the certification to provide this type of content. He went to school. He is a doctor, so like.
Yeah, but even the doctors who have the certs, who are on the airway side, they're not getting that exposure, And maybe it's just because they don't have the social media campaigns, but maybe it is like some people say in my comments, where they're like, they're trying to fuck people up. Like, they want people to have fucked up brains and a proclivity to addiction.
Yeah.
And no discipline, and they want them to constantly be coping with having terrible energy levels.
It provides,
and
it provides
smoking
patience.
weed, watching porn, no self-confidence, no sex, no ability to procreate, because you don't feel comfortable talking to other people because you're so unhappy with the way you look.
Yeah.
It's sketchy.
All it takes, Ron, is one influencer to have the right type of videos, right type of structure, right type of publicity. I feel like the real formula for the algorithm is Mr. Beast. First 10 seconds of the video, he tells you exactly what it's going to be, shows you everything about it, and his algorithm is boom. You know that. The viewer retention. So I feel like all it takes is one person on this platform to really expose this in a Mr. Beast-esque video that will bring the type of spotlight that Mike Mew has somewhat achieved, because I feel like he's the only real popular person I feel like
airway guy.
Yeah, exactly. So
Yeah.
that is on the upbringing. I feel like it is very near in the future to have somebody maybe possibly watching this video to make a video like that, or you or anyone. So I think back to Mike Mew and his in the UK. These are the same people who found Johnny Depp to be guilty, and then when they came over here, he wasn't guilty. So like, are we really gonna take the UK's trial seriously? Because I guarantee you the non-believers are going to look at Mike Mew losing this case, which most likely he will, and they're going to say, hey, boom, this motherfucker's crazy, he's been wrong all along, they're swept under the rug, fuck him.
Yep.
So then what then?
Yep.
It's going to take another 10, 20, 30, 40 years before another Mike Mew pops up, because he's going to be blacklisted. He comes and tries to get a trial here. If he comes here, like, I don't know. But still, like, I just, like you said, evil rules, and it's up to the people who really care to bring the truth to light. It's always an uphill battle.
For sure. That's why I want to get involved with Mike, and that's why I'm having him on my channel, and I might have him on again soon, because this is bigger than Mike Mew.
Oh yeah. This is there's a lot at stake with this, right? Like, Mike doesn't just represent Mike in his own individual practice. Mike represents a whole belief system around the proper way to treat people when it comes to orthodontics. Right.
And if Mike can be demonized, then this whole belief, this whole theory of practice around expanding rather than extracting and retracting, that can be demonized with him. So, this is, I don't want to make it too big, but it's big. Like, if Mike is going to go down, he's going to go down with a fucking fight.
Oh yeah, for sure.
And it can't be like other influencers when they get canceled and everyone just goes silent around them because they don't want to get canceled by being associated with the guy who got canceled. Right. Like, I want to make noise, and like, if I want to help Mike.
For sure. I feel like the last video, or the first with you guys that he did, he was in a very accusatory position. He was really defending himself of the trial rather than really talking about what. I love this man. He really he's a pioneer of this. But I feel like you guys should definitely do another video going more in depth about what's going on, and as a first time viewer watching it, who is clueless to this. So I feel like the influence part is still being established, and Mike Mew has so much information, so much documentation. He's the real doctor here. I'm not actually. I think he got his license revoked, right? So like, he's done this, he's practiced this, he has the evidence. So if there's anybody to talk to, it's Mike Mew. If there's anybody to listen to, it's him. So like, he's the biggest influencer on this. I think that's crazy. And with him mewing, I think there's more to be said about the effects of mewing and possibly the downsides of mewing. I really think if your palate is narrow and you're trying to mew and your tongue is tipping over your teeth, and you're pressing and you're constantly swallowing, that's going to wear down your teeth. Mm-hmm. If you're hard mewing and your palate is so small, because it's gotten to the point where my tongue is literally curling to stay inside of my teeth. Because if I expand my tongue, like, it is much bigger than my teeth. So when I'm pressing up, like here, it is applying pressure and friction or abrasion to my teeth. So when I'm swallowing or if I'm mewing, it is possibly causing gum recession or deteriorating my teeth, like on the molars. So that's also another thing. So that could be fixed with tipping the teeth with a removable appliance. So the possibilities are endless with this. I feel like we're just such at like a beginning stage. Like, this hasn't even started. Like, we're in like the pre like boom of this, of like what possibilities and combinations of mewing and dental appliances can be really used to like utilize and get the most out of this, to get the most out of mewing. Because like I said before, I feel like mewing, if you're super consistent with it, could have an impact on like the bone of your maxilla, your hard palate. But I feel like it has more to do, and what's more important is your the soft tissue of this of the palate. I feel like that's the most important. So yeah, I mean, like I said, I believe the positioning of the teeth have an influence on the rest of your face, because the biting force, the way the muscles go on your cheekbones. I feel like it's so much more complex. There's so much more to extract out of this. So I'm really excited for the future and for you and your channel. And I'm an advocate for you. I'm always gonna shout you out wherever I go. So
I appreciate that.
Of course, man.
Maybe you should start your own channel, and you should be
really
an
thinking about
influencer in
it.
this space.
I was really thinking about it.
I think you should. If you do, then we'll get you right back on the channel, and we'll just point this. We'll point the next video to your new channel, and then hopefully you can get a launch with a quick 1,000 subs and just run with it, bro.
For sure, man.
I mean, like, I almost feel like you have a duty.
For sure, man.
I almost seriously. Maybe you could do like a song or like a track or like a freestyle about it.
Yo, no, that song's gonna be a diss track on my orthodontist. Dead ass.
Yo, a diss track.
Fuck.
I ain't never claimed to be no Ray Benzino,
Hey.
an 83-year-old fake Pacino.
Hey.
So how can he hold me over some balcony without throwing his lower back out
Ooh.
as soon as he tries to lift me? Bro, hip hop is all I listen to. I listen to hip hop and classical.
Oh, I know you have a classical playlist. Man, I sound like a fanboy here. But yeah, man, rapping. I love all types of music, indie, rap, everything. I feel like classical does something to you. I feel like it calms you, puts you in a sedated state.
Yo, who did this to you? Not Mike Mew.
Nah.
It was some other dude down the street at the orthodontic clinic, the one who did it to you too.
Yeah. When I see him, it's pew pew. Feel me? It's over. It's raps.
Oh, yo, no violence, no violence.
No, yeah. No violence. It's MSC.
MSE for me, please.
Mm-hmm.
That's how I be. Expand the bone. Don't expand the teeth.
Right.
B.
Hey, come on now. Hey, we should make a song together, bro. We should make a music video.
So I'm down.
Don't be bland. Motherfucker, expand.
Chill.
Hey.
Let's go.
Man.
For real though. For real. No, if we could bring other types of art to this, and like, because like one of the, and we'll wrap in a minute, but like around the political discourse that was happening in America during the Trump presidency, it was extremely divisive. But one of the formats that I feel like actually got people to like, got the sides to come together was that rap song. Well, you know what I'm talking about?
Yeah, Lil Baby. Shout out to Dion.
Not Lil Baby. The music video was like he was like a fat white dude with a MAGA hat on one end of the table, and then a black guy on the other end of the table.
Lucas.
And Joyner Lucas, remember that track?
Yeah.
And then the white dude was like, "This is why I'm MAGA," and then the other dude was like, "This is why I think MAGA's bad." But like it created empathy. So there's something about music that people hear it in a way that they don't hear a guy like me or a guy like you who's just talking and just saying what he believes.
Right.
There's something about music that softens the blow.
Yeah.
Comedy does the same thing.
Yeah.
But we're not comedians. You're a musician. So something to think about.
And I feel like the people who watch these videos are people who already know about it, or this has already happened to. So, like I was saying, there's a void to be filled here, waiting. It's inevitable for content to be made and produced to get on that, the algorithm. So I feel like it's inevitable, bro. And that content of whether it's comedy, whether it's music, whether it's a funny video of about this, or an informational video, because there's attention spans are becoming shorter and shorter, man. Like it's literally
Facts.
2 to 3 seconds or it's done. So those first retention, that is so important. It's really important. So videos that are clickbaity, like how to get a more, like Mike Muse, if you go on the most popular videos are the most clickbaity ones, where it's like how to get a more prominent jawline, how to do this, how to do that. Those are his videos that are most popular. So I feel like there is a void to be filled, and it's inevitable. So I'm really excited.
You're so right, man. And as a musician, you would know this better. It makes me think of this thing I heard on NPR like 10 years ago, how when there's like this one studio in like Scandinavia that produces all of the hits on American radio, and one of the rules that they follow, you got to have a hook every 7 seconds, because every 7 seconds the human attention span is like, all right, nothing here, change the channel.
Yup.
So every 7 seconds you need a hook on the track.
Right. I feel like
and maybe
Playboy Carti does the best job at that, because it's such like vibe music. You can like be not even listening and still listening. Like you're not gonna sit there and be like, oh, I'm ready for this bar. It's more like you're chilling, doing whatever, and you're listening to it, and you hear the rhyme, you hear the tone of his voice or the pitch, and it all comes together that way. Like that's the direction we're going, I feel like, especially with music. If you go on TikTok, you see videos uses songs that are sped up, because people's attention spans are just so short. Like they want to hear like the best parts of the song like sped up, so you can make like a shorter video. So it's wild, man. It's wild.
Oh my gosh, man! It's being taken to an extreme.
Mm-hmm.
But this is just the natural flow of it. Like, there's no reason to resist it. Just lean into it and incorporate it into your content.
For sure.
I'm not even on TikTok. I don't even have it on my phone to like as a consumer. But people tell me all the time, "Why don't you make a TikTok?" And I'm like, it's just not my vibe. But maybe
I can see you on
should
TikTok,
become
bro.
my vibe.
I can see you on here for real. I mean, you can just take the clips from here and put them on TikTok.
Speed them up 2x.
Yeah, right. Or like YouTube Shorts are really popular. Right? When those came out, I thought that shit was so dumb. I was like, man, what the fuck? But then I found myself on YouTube Shorts sometimes. I'm like, man, I gotta get out this shit.
I know. I did it for the first time the other day. I scrolled YouTube Shorts, and it was like TikTok, because I've seen TikTok on my sister's phone, but it's the same thing. Because YouTube knows what TikTok taught us, and Instagram is trying to do with Reels, which is like people want to scroll and they just want to hit with it. Just hit them, and hit them fast before they scroll to the next one.
You know, in China, I'm not sure if this is true or not, but the videos that they allow the people to watch are informational videos. It's not women twerking. It's not stupid videos of a dog or like irrelevant, videos. It's more,
or the dentist.
Yeah, right. It's more informational videos. So like the youth is being informed rather than, I don't know. There's difference.
Corrupted.
Exactly. Like consumption, what you consume, into your mind. People say like, oh, you got to eat a healthy diet. Well, whatever you watch is what you are. If you're watching stupid videos, if you're watching things that are not pushing you to become better or aren't informing you of anything else, like I feel like that's just gonna be who you are. Like that's where the youth is heading. I hate to sound so like negative about it, but or old-headed about this shit, but like, damn, bro, like I look at these children watching TikTok and it's just like, what the hell, bro? Like,
no, your cynicism is warranted. You're right. It's a drug either way, and in China they're giving their people fucking high doses of vitamin D and steroids and like the good shit. They're giving them the liver pills, right?
They're gonna get MSCs
in America,
as kids, man. Well,
Yep. And in America, they're pumping us with the heroin. They're pumping us with the shit. They're pumping us with the dirty, the crack.
Yeah.
Not the good crack, just the bad crack, the crack that rots your teeth. So it's fucked, man.
Not the blue meth.
But you're right. It's not the format that's inherently bad in and of itself. It's just when you take the format and you use it as a vehicle to pump the people full of fucking misinformation and fucking rot.
Yeah.
That's when you get trouble.
Yeah, TikTok is definitely a dual-wielded sword. It just it's crazy, like the potential of it, but it's just being used to manipulate and influence to a significant degree. Like people say, am I allowed to get political for a second? Not like super, but
sure.
I feel like the 2020 election with Biden and Trump, he was like, oh, it's rigged, the ballots were rigged. I feel like the real rigging of the election was the influence social media had on younger voters. Really. Like, you went on Twitter, Snapchat, Instagram, all you saw was propaganda about how bad Trump was, or, you know, I mean, that's always been there, but it was very amped up around like election time. And I was like, wow, that's crazy. And I feel like social media has such a great influence on the youth. Like, it's wild. It's so wild. Like, 20 years from now, we're going to study like our brains and like our attention span. I feel like it's going to be like such a drop off from people like that, or it may not be even studied at all, but we're definitely headed in a very odd direction, very weird direction.
One other connection I'll make to what you just said, what they're doing to Trump now with the lawsuits, it's just one lawsuit after another, they're just bogging him down in court, is kind of like what they're doing to Mike Mew. They're just bogging him down in court, drain him of all his own money by making him spend it on lawyers, on these sham cases, to just fucking keep him busy by constantly answering subpoenas and whatever else they do with their infinite supply of their own lawyers, and just fucking, you know,
sad.
Bog him down.
They can do that to him. They can do that to anybody, you know? Like,
yeah. They can do it to Mike.
Yeah.
They're doing it to Mike.
Exactly.
They're doing it to Mike. So, by the way, neutral observation.
Oh.
Neutral observation.
Oh yeah. No.
Just saying.
Yeah, come on.
There's a similarity there.
Yeah. Yeah, not to put his name with Mike Mew, but, you know, it's the same thing. It's very similar. You know, people who like to play sides and to an extreme, especially on Twitter. I feel like it's the most, you see like the most dumb shit. Like, it's wild. People will say things just to say things, just because they know other people are going to look at it. And, you know, if you're not pushing a certain, man, I don't even want to get into this. I'm not even going to get into that. A certain agenda.
Feel free, man, if you want to finish your point.
Oh, I'm good, man.
Go ahead.
The people who know already know, so I ain't got to say that.
They do. Everyone, most of the people watching this are already fucking pilled.
Yeah.
They're pilled as fuck.
On God.
They know, bro. They're more pilled than me.
For real. Man.
You know, they're more base than sodium bicarbonate.
Oh my God, that was a bar. Man, how long were you thinking about that one? Was that off the dome?
If you rewind the video, it was about 6 seconds.
Oh, okay.
We're
on the dawn, man.
I was thinking about the most basic chemical I could think of.
You a genius over here.
I don't know about that, bro. How much of a genius can you be when you've got fucking sleep apnea up the ass?
Right.
You know? I'm a crippled brain. Lacking in oxygen. So I supplement with Mary Jane.
Ooh.
Just to make me feel not insane.
Ooh. Come on now, keep going.
It's just the way it is, bro.
It's just the way it is. Come on now.
Quit while you're ahead.
Right. Damn. There was so much I wanted to. I feel like we hit. I don't know if you can see this. Literally, so much I wanted to talk to you about.
Did we talk to it? Did we talk about it all? Or
I feel like we did. There was one thing. Just gonna make sure. Another thing was Facemask. I know one of the videos you just made, there was a Facebook group where he achieved significant progress on the sagittal plane with Facemask, and I thought that was really interesting. And I feel like would you have to expand, like I saw this one research study of no expansion and protraction, but it's tooth-borne appliances. So like, what if you did the screws and then protracted without expanding? So like,
without the MSE? Yeah.
So like,
it's not the same. So
you have to split the
it's
suture.
Not often tried. There's something about disrupting the face with the MSE that loosens it up. It's almost like you take butter and you put it in the microwave for a few seconds and it softens.
Right.
Like the MSC seems to have that effect on the bone where it makes it easier to bring it forward. And it's already a brutally slow process. I mean, in that video I did, that was 18 months. 18 months to get a good change, bro, but that was 18 months. So even if the MSC is just, let's say it gives you a 100% improvement in the rate of expansion, I mean, are you really going to wear a face mask for 36 months to get that result? But I don't know if you need that much.
Right.
Maybe you only need a little bit.
Right. Like maybe how much is a centimeter? What, 10 millimeters? I don't know.
10 millimeters, yeah.
So
you might need 2, 3.
Yeah.
A pittance.
Right.
So, what? You don't want to do the MSC? Do you feel like the MSC could hurt you more than it could help you?
No, I was just really thinking of different ways to protract. And I mean, I don't know. People always have imbalances in the face. Like I had an imbalance before I even had Invisalign. Like I could tell like the left side of my face was more prominent than the right. Just little things you realize about yourself, and everybody does. So that could either come back, make it worse, or not. Whatever. Because like if it gets to a point, I feel like expansion with the MSC, like when do you stop it? Because it's a constant force. So like what if it at one day it's like, okay, come back in a month or come back in a couple. I'm not really sure, but I don't know. I don't know. I was just thinking of other ways. I do believe I need an MSC 100%, but I do believe also that I was retracted a significant amount. So I need protraction, and maybe protraction and tipping the teeth a certain way will have an influence on reshaping the face. But like you said, you would need a bone graft to really even add anything in the first place. So once the bone dissolves, then I don't know how malleable bone is, but if it's enough to cause this divot because my teeth are relapsing, is that the root resorption for my teeth, or is that my mandible just becoming smaller? Like I'm not really sure. Anyways, the MSC, I think I need an MSC because of the airway. Like I want to expand my airway. Protraction, I believe, helps more with obstructive. I'm not sure how much of an impact it would have on the nasal floor protracting, but I feel like expanding transversely is going to have most of an impact on the airway, and I feel like that's what I need. So I mean, that's the most important thing.
Yeah, I think that your issue started when those elastics went in, especially, and those elastics pulled you back. So I think front back is the heart of your problem. I think that a little left right can only help, especially given the fact that we know you're not about to go get double jaw surgery. Bro. You're just not. So then the question, some people need it. Like, all right, fine. But the question for you is, how are we going to protract you without double jaw surgery? When you start talking in those terms, you have just
limited options. Yeah.
You have face mask. To get the face mask to work, as far as we know, you need an MSC. The MSC, you don't need to expand it much. To get the face mask to budge, you probably don't need, bro, probably don't need much. Maybe, let's just throw a number out there, 5 millimeters. That's 2.5 millimeters each side.
Right.
That's not that much. That might be enough to loosen you up, to get that pull. Or the other option you have is tooth-borne expansion. And if you're going to do tooth-borne expansion, you got to do it responsibly. You got to do it with SFOT. That's also an option for you, bro.
Yeah.
That's out there. But, I think that because you have a more holistic point of view about all of the bones of the face being connected, I feel like you would be more inclined to want to choose the face mask, because the face mask is going to affect all of the bones of the face.
Right.
It's going to pull the whole shit forward.
Yeah.
Right? So, but you could maybe, you could even do a little bit of both. Like you could do the face mask and push it as far as it can go. I guarantee you it'll probably be enough.
Yeah.
But if it's not, and you're still struggling, right, then you could just the gravy. You could just sauce it up a little bit with a little bit of tooth tipping, and just tip them back to where they were before the other doctor put them back.
Yeah.
So, you're really looking at MSC face mask at a very moderate level, or a very modest, like, Wilcodontic SFOT type movement of the teeth, or maybe a little bit of both. But I guarantee you can get to where you were without surgery.
And
you just need a doctor to play ball with you.
yep, exactly.
And Zubad Nuaz will execute on that plan.
How do I spell that? I was trying to spell that. I think I butchered that shit pretty bad.
Yeah, no, it's all good. Zubad, Zubad, and then his last name is Nuaz, Newaz, and you can just go to nuazortho.com. He's in Florida. He's in Jacksonville, so you could get there. You just got to go up what's the coastal highway? Is it 95?
I think so.
I don't know. Yeah, 95. Not 75. 75 is the other side of the state.
Jacksonville is what? North Florida, right?
Northeast.
Northeast. Yeah, I'm in south
northeast
of Miami, so it's like I could probably fly there. I don't know. I'd probably drive there. I know they got a...
I think it's probably three hours in the car, bro. I drive more than that to see my guy from Boston to New York.
Shit, man. It's worth it, bro. I honestly don't even care. I want to fix my shit. So...
Yeah. High key.
I mean, we'll see. Here's just speculation that I have.
Okay.
Retraction causes less space for the brain.
Maybe.
What do you think?
Bro, my experience with the body is that it's a complex system, and anytime you violate nature, there's going to be an untold number of negative consequences that come from that. So I can tell you, in my case, I have what's called a Chiari malformation, which means that the back of my brain is literally bulging out of the bone at the back base of my skull. It's a rare thing, and I always thought that I have the Chiari malformation because, like, my shit just didn't develop fully, because I had, for whatever reason, the orthodontic extractions didn't help. But I always felt like it was a symptom of my skull being too small. And I think it's probably related to the pain that I have at the back of my neck. So that's just my own anecdote. But, hey, if your head is smaller, does that mean your brain is going to, it's not going to grow to its fullest potential? Could be, man. Because that's the case in other ways, right? Like, women who are smaller have smaller babies.
Yeah.
Because the baby grows to the body of the woman.
Mm-hmm.
I think it's possible. But at the same time,
it may not be as significant of an impact,
Well, I was going to say there's a lot of really high IQ people who have really small heads and small faces. So is their brain big but their airway is small, or maybe intelligence isn't directly related to brain size?
Yeah, I don't think it is.
I don't know.
I don't think it is, but I feel like you as a person, relative to your brain size or whatever, regardless of what your IQ is, if you retract and this, like I was showing you the soft tissue here, this is bringing this back. Does that, what about here? Because one thing I noticed, man, I'm getting in deep about this. This is like crazy. I don't really want to talk about this, but when they retracted my teeth back, I feel like either the biting force or the muscles changed, like, back here as well. Just me guessing, but if you retract this, is this being pulled back as well? I doubt it. But if you're bringing this back in the forehead, this bone is being brought back, is there going to be inevitably less space for the brain? Like, I don't know, but that was just a thing I thought of. But it could be true, it could be not. We'll see.
Yeah, I don't know. Another thing that comes up, though, is that a lot of people who have been through this treatment have headaches. And what are the headaches caused by? I believe it's mostly caused by compression at the back of the neck and, compression and strain of the nerves at the back of the neck caused by poor neck posture, caused by having a small airway. But is it also caused just because there's more pressure on the brain because the actual, intracranial space gets decreased?
Yeah.
It's possible, bro. Who knows?
Man, I do believe one of the biggest things about this conversation we've had was one of the biggest points I feel like is the most important was the misinformation that's out there and the lack of research. Well, like pro research,
honest
exactly.
research.
That's not pushing an agenda to defend what they have. Because if you really look at it, most of it is in defense rather than to prove something. And I thought that was crazy because as somebody who doesn't know anything about this, somebody who hasn't, nobody in their family has orthodontists. They probably know a friend who got braces. Mom or dad finally saves up enough money to get them braces. They may have really crowded teeth, up here. They want to get braces. They finally get braces, and they go to an orthodontist who still believes in extraction because, trust me, when they're out there, they get their molars extracted, however many teeth it is, and then they start having this airway. If they were to look up before they got braces, what are the downsides of this? What are the positives of this? It to me seems like there is no positive of braces besides correcting, the smile. But like, what is a correct bite? There's a standardized bite. When I visited one of the doctors, they looked at the width between my molars and they said, well, you're about where the standard is. And I'm like, well, ma'am, like this isn't where it was. And she was like, well, this, according to this chart, like, we look at this for all of our patients. This is what the standard is. But it's like, in correlation to what? Average? What you guys think should be, how wide my arch should be? Take into account my tongue, take into account the rest of my face. Like, you're going to sit here and tell me that every person should have the same bite? Like, it doesn't make any fucking sense to me. So, like, back to my point about, like, the research. If you look it up on Google and even if you go 2 or 3 pages in and you look at these .coms of the list of pros and cons, you're not going to find shit about the airway. You're just not. These dentists and orthodontists are paying too much to advertise these to be at the top front of the pages that you're not going to see anything about airway. You're not going to see anything about the impacts on your face. So that is criminal. That is wrong. That is absolutely mind-boggling to me. That if it's literally like you can't even avoid it. Unless you look up on Google Scholar, and even then you're going to get the people defending it. So, and then if you go to a doctor asking them about this, they're going to say, no, there's no correlation at all. Bro.
Yeah.
That's...
Yeah.
This is literally an epidemic. It's wild.
It's an epidemic of the body, and it's an epidemic of the mind. It's an information warfare campaign.
Yep.
And, in this video, we're fighting that, okay?
Yep.
We're providing a counter attack to their, bigger attack that you're seeing on the mainstream channels and on the front pages of Google. So at least, we're doing something to make noise in the face of all that.
Yeah.
All right, and let's just go with that.
Yeah.
All right, and keep fighting that information warfare. Right. Because ultimately we have the truth on our side, and because of that, whether it's even if Google isn't smiling upon us, the gods are smiling upon us. Okay? Somewhere out there's a higher power that loves truth and that loves justice and that loves goodness, and they're on our side. Okay, we have that.
Yeah.
All right, bro.
Man, this is literally so crazy, man. When I discovered your channel 2 or 3 months ago, I was watching all your shit. I was like, man, like finally somebody on YouTube who, besides Mike Mew or other doctors, has really experimented with AGA, really experimented with MSE, and has done this. Because I was at the point where I was like, I want to do this. I don't want to get jaw surgery, because everybody was pushing me, dude, just get jaw surgery. Like, fuck it. If this is what the doctors are saying, just do it. And then I found your channel, and I was like, man, like he really did it himself. Like, you are a literal pioneer of this. Like, you're inspiring, and you have inspired more than you think. In the future, people are going to look back on this and look back on your channel and say, man, he really, stuck it to the the corporation and did what he wanted to do. Because like that's what you did, man. Like, so I really admire you and the information you're providing, man. Seriously, Ron, you are a godsend.
I appreciate that, bro. Honestly, heart to heart, man, that means a lot. And I want to get you back on because you are an amazing energy to bring to this channel, an amazing mind, an amazing heart to bring to this channel. And we got to get you back on to keep spitting truth. And I want to, let's plan on it, all right?
Sure.
And no later than a couple months, I want to get your update.
Right.
I want to have you back on. No charge. Don't just email me, and I'll get you on. We'll do another hour,
cool,
or whatever. And I just want to hear your most recent thoughts because a mind like yours moves fast. I guarantee you in a couple months from now, you're going to be on a whole nother level.
Man, I hope so, man. And I really
All
appreciate
right,
that offer, Ron. Seriously.
No, I know it, man. I know it. No, I'm doing it for my audience because, you're a gift to the audience. So
well, thank you.
Let's do it. All right?
Let's do it, man. Man, thank you, man. For real, Ron, like, you ain't got to put this in, but Ron, seriously, bro, I really appreciate you having me on and taking the time to listen to me. I know we're a bit over an hour, so seriously, thank you. I really appreciate this and your wisdom.
A bit over 2 hours.
Yeah, no, seriously.
All right, my man. Hey, and no pressure, but maybe next time you're on, have a couple bars ready to spit
yeah.
at the orthodontic establishment.
Oh yeah, I got you, man.
Okay.
Yeah, cool. Get on TikTok. Get on
you
TikTok.
don't have to work.
Sir, seriously, get on TikTok. Make a TikTok account.
All right.
You have to. That's the trade.
I got you. All right, bro. All right, you have a good night, man.
Yeah, you too. Appreciate it.